Hi folks, this is Hariom for CVNA. This is our fifth in a series on muscles. So today we are going to talk about one of the common myths or mistakes in physiotherapy in terms of stretching, right? Stretching a muscle. Now, we know that muscles tend to get shorter predominantly in two major conditions. When there is a lesion in the brain, whether it's the spinal cord or in the brain itself, right? That is one type. I am clubbing UMN and LMN lesion because we will try to see why I am clubbing those two. And the other one is probably post-traumatic stiffness, or you are in a particular posture for a long time and you got stiffer, not necessarily because your brain was damaged. So these are the two issues we are going to tackle today. Now, one of the common things people tend to have this idea that if a joint is in this position, right, the idea is that you should bring it here, right? If it is here, then the idea is to bring it here. That seems to be sort of a Tharaka Mandram in case of physiotherapy, right? If it is flexed, straighten it. If it is straightened, then flex it. I have again made a setup where we will assume this to be muscle, that is the theraband to be muscle, and this is to be the origin, and this is to be the insertion, right? Now, when you want to maintain the property of the muscle, that is here what I mean by property is length as well as the other things inside, right? If you want to maintain the property of the muscle, what has to happen is this has to happen. That is, the muscle has to be contracting and relaxing. Then only you get the property of the muscle. That is in a normal individual. The length of the muscle, the other properties like the thixotrophy and things like that are all maintained by when you are when the muscle is contracting and relaxing. Now, so if it is a brain lesion, right? There is a brain lesion, and the muscle is going in for contraction, right? Contraction or tightness. We will not get into the semantics of what it means, what is a contraction and what's a tightness at this point of time, but we will assume that it is going like this. So what is our first instinct is try to push it like this to make it to the right position, if you will, right? If it is like here, right, if it gets tighter and tighter, we tend to push it harder and harder to take it to that particular position, right? To take it to the right position, if you will. And if you see all the evidence, right, all the experiments, you will see, if you have a reflective practice, that is, if you are looking at your own patient, you will find out that you will never be able to, if it is contracted like this, you will never be able to get it to this place. Never, ever, by stretching, right? What is the reason for that is, remember, it is not putting in this position that is not the important part to maintain the muscle. As I told you, the important part to maintain the property of the muscle is to contract and relax. In a brain lesion, that is what is missing. That is inability to actively to do that movement. Either it is completely lost, or it is moderately lost, or mildly lost. In a sense, right? That is, in a weaknesses in different levels also. So also in the earlier video, we also saw that how weak muscle also tends to want to be in a contracted position, right? So to keep on pushing it to this position and thinking that, see, I have stretched it, and thinking that that is the treatment to maintain the muscle length is just ridiculous. You can go and see Cochrane reviews on UMN lesion and stretching, and it will be always a failure. The other instance where the muscle gets shorter or there is some amount of tightness in your joint and things like that is probably an adaptation, not necessarily due to a brain lesion, but probably post-traumatic stiffness or due to pain and things like that. Then at that particular point, what happens is people are not only just stretching if the muscle is again contracted, right? They are not only stretching, the patient is also doing some active movement. Either you are prescribing them or they are using their, when they are doing aerial activities, the joint is automatically moving. Like in case of knee joint, you sort of stretch your knee and things like that. And then you are thinking, after some time you see there is a considerable amount of increase in the range of motion and things like that. And that is not primarily because of your stretching of the muscle passively. It is also or primarily because the patient is able to do this active movement. Even if it is a little active movement, he is able to do that, right? So to summarize, if in case of UMN lesion, if the joint is like this, if you are just putting it here or putting it here, that is of no value. You need to remember, you need to have active range of motion in the contracted region or in the tighter region to maintain the properties of the muscle or to change the properties of the muscle. So just doing passively does not work. The experiments have proved it. You would have seen it hundreds of times in your patient. But at the same time, if it is because of not because of your lesions in your brain, but because of pain or other kind of reasons, post-traumatic stiffness kind of reasons, then you have a chance of not only stretching passively, you are able to do active movements also, right? The patient is able to do active movements also. That leads to change in the length of and also change in the range of motion of the joints also, right? Thank you so much for watching this video. If you want to watch more videos like this, subscribe to our channel. Thank you.